You need a psychiatrist. 10 signs you're a narcissist.
Understanding narcissism and identifying its traits can be complex, as it often overlaps with other personality characteristics or behaviors. Below is an exploration of the questions you've raised. 10 signs you might be a narcissist. If you're wondering whether you exhibit narcissistic traits, consider these common signs associated with Narcissistic Personality Disorder, NPD. 1. Grandiosity. You have an inflated sense of self-importance and believe you are superior to others. 2. Lack of empathy. You struggle to recognize or care about the feelings and needs of others. 3. Excessive need for admiration. You crave constant attention, praise, and validation from others. 4. Entitlement. You expect special treatment or privileges and become upset when you don't receive them. 5. Exploitation of others. You use people for personal gain without guilt or remorse. 6. Arrogant behavior. You display haughty attitudes or dismissive behavior toward those you perceive as inferior. 7. Envy. You feel envious of others or believe they envy you. 8. Manipulation. You control or manipulate situations to get what you want, often at the expense of others. 9. Difficulty handling criticism. You react poorly to feedback, becoming defensive, angry, or dismissive. 10. Frequent fantasies about power and success. You daydream about achieving greatness, fame, or admiration. How can I tell if I'm a narcissist? To determine if you might be exhibiting narcissistic tendencies, ask yourself the following questions. Do I consistently prioritize my own needs over others? Am I overly sensitive to criticism or rejection? Do I find it hard to empathize with others' struggles? Do I feel entitled to more than others in most situations? Do I take advantage of people without feeling guilty? If you answered yes to several of these questions, it may indicate some narcissistic traits. However, only a qualified mental health professional can diagnose narcissistic personality disorder. What can be mistaken for narcissism? Some behaviors that resemble narcissism, but aren't necessarily indicative of NPD include high self-esteem. Confidence is not the same as arrogance. Healthy self-esteem doesn't involve exploiting others. Introversion or shyness. Some individuals may come across as self-absorbed because they are uncomfortable in social settings, but this isn't narcissism. Social anxiety. People with social anxiety might avoid empathy due to fear of judgment, not out of entitlement. Cultural differences. In some cultures, assertiveness or individualism may appear narcissistic to outsiders. Temporary stress reactions. During stressful times, anyone might act selfishly or lack empathy, but this doesn't mean they are a narcissist. How does a narcissist apologize? A true apology involves acknowledging wrongdoing, expressing genuine remorse, and making amends. However, narcissists often struggle with apologies because they rarely admit fault due to their inflated sense of self-importance. They may apologize superficially to manipulate or placate someone rather than out of sincere regret. When a narcissist apologizes, it might sound like, "I'm sorry if you felt hurt." Shifts blame onto the other person for feeling upset. "I didn't mean to upset you." Avoids taking responsibility for actions. "Let's move on. I promise I won't do it again." Focuses on resolving conflict quickly without addressing underlying issues. Genuine apologies require vulnerability, which many narcissists find difficult to express. What is the number one narcissist trait? The defining trait of narcissism is lack of empathy. This inability to understand or care about the emotions and experiences of others is central to narcissistic behavior. While other traits like grandiosity and entitlement are prominent, the absence of empathy distinguishes narcissists from those who simply have high self-esteem or confidence. Final thoughts. If you suspect you or someone close to you exhibits narcissistic traits, seeking guidance from a licensed therapist or counselor is essential. Therapy can help explore these behaviors, foster self-awareness, and improve interpersonal relationships. Remember, recognizing problematic patterns is the first step toward positive change.